Welcome to Best Practices in Lab and Clinical Instruction, presented by Deborah Buck, RN, Nursing Assistant Program Consultant for the Oregon State Board of Nursing, and sponsored by Acquire Training Solutions.
One of the first things we know is that all skills should be return demonstrated in a lab setting on a mannequin, on another student, before you actually turn these individuals loose on a real live patient, right? Or resident or client, whatever you want to call them, okay? And, this is obviously a nursing school lab. Isn't that nice? They've got all those beds and probably have tons of equipment, and you're going to say, well, that's great. If I had that many beds in my training lab, I could do this. We're going to talk a little bit about how you can do your lab if you don't have a huge room. We're going to ask you to kind of think outside the box, because I've been in your training facilities. I know what your space restrictions are. In fact, most of our nursing homes in the state have taken any little closet that could possibly be and turned them into offices, because these buildings were never meant to have as many administrative type people as what it takes to run a facility today. And every corner, nook, and cranny is now filled with an office. We're going to spend a little bit of time talking about this. In the lab skills, when you're demonstrating those skills, I want to make sure that you're using the most current skill sheets. If your skill sheets do not say 51508 on the bottom, you are not using the most current skill sheets. A couple things I'd like to say about those skill sheets. They were never ever meant to include every step that you might want to teach. Those of you who were around and helped develop them know that the purpose of those skill sheets was there's a state statute that basically says for any certification or licensure exam, we can't give away the criteria by which that person will be tested. So we couldn't give you what the testing steps are for the state certification exam, but we could build those steps into skill sheets. And if you have them do as a minimum the steps that are on those skill sheets, they will pass that state certification exam. Those are the same steps and procedures that they're taught through this online program as they're being taught in your other programs. I just want to make sure that you're using them. But let's talk about that lab setting and how to do labs. This is one tried and true method that I am very confident in. I've seen it work for at least 20 years now. You really do need, though, to keep your numbers of students around the bed down to a reasonable number. I think 3 is perfect, 4 works, but when you start getting 6 or 7 people around a bed, what you're going to find is that you've got people standing there not engaged in their learning. So let me explain what this little visual is trying to tell you. First, you have one of your students in the bed acting as a resident. Another student is acting as a nurse aide who's actually performing the skill, starting with step 1, knock on the door, all the way through the last step on that skill sheet. Your other 1 to 2 students has a copy of the skill sheet in their hand. I've actually seen some programs who have laminated sets of those skill sheets and with grease markers, and they will give them to the students as they stand there and do this, and the students can mark off as they observe, because they are quietly not making comments while the nurse aide is demonstrating on the resident. They are simply checking. Yes, I saw you knock on the door. Yes, I saw you pull the privacy curtains. Yes, I saw you wash your hands. When the whole skill is done, they all 4 gather around the clipboard with the sheet on it and say, okay, you missed this step and you missed this step. And they talk about that. And then they switch roles. All 4 people will play all 3 roles before they move on to another skill. Now, when I first started this with my students, you got a bunch of strangers that show up for clinicals that probably haven't spent a lot of time together, especially in the long online program. The first time the students may meet each other face to face is the first day you see them in lab. You have to quickly get them comfortable with working in front of each other performing skills. And this works really well that way. At first, people are going to be hesitant to go first because they're afraid of not being perfect. But they're soon going to discover that nobody expects the first person that goes to be perfect, do they? And as I've done this for a period of time, my students quickly figured that out. And the one they didn't want to be was the last person, because students are pretty hard on each other. And by the time they have watched 3 or 4 people all do this skill, they expect that very last person to not miss any steps. But they're all actively engaged in the learning process, and that's why this works. Some of you are saying, okay, I can do that, but I don't have that huge big room with a bunch of beds. So here's a couple options. One is, if you do have a fairly nice size room, you can actually set up stations. So station 1 here, that's a bed with a little bedside table if you can't, or bedside stand, and you'll need a bedside table there. They could do bed making there, bed bath, positioning, mouth care on a comatose patient, and range of motion. On another bed, station 2, you could have them demonstrate the bedpan urinal, the cath, the pericare, the enema, that set of skills. Then you can have a station 3 for shaving and hair care. Station 4 has your nail care and your foot care. As you see, you can put out different tables. They can be card tables, they can be those fold-up tables. You just need enough space to put out your material. Nothing fancy, but it just gives them an area to go practice these skills. If you say to me, well, I don't have a room big enough to put up all those stations, here's another alternative. Day 1, you set up 2 stations, and everybody rotates through those 2 stations. Day 2, you could take station 3, 4, and 5. You can set the stations up, dismantle them at night and set up different stations for the next day. Or you could have a couple different rooms that you, as the instructor, navigate between. Because remember how I told you to do it with those 3 to 4 individuals per bed? What's the role of the instructor then? Your role is observing the process, making sure all the students are actively engaged in the learning process. You are simply going from group to group, making sure the students are engaged and answering questions, clarifying the procedure steps, giving a little bit of assistance, and moving on. So even if they're kind of in 2 different rooms, you can still be monitoring them. It just takes some organization to set a system like this up. I can tell you from experience that my students found this fun to do. They loved doing the lab days because we also made some things were kind of fun. On the dressing and undressing, we'd throw in some funky looking clothes too. It wasn't all your standard ones, because it just gave them a break, gave them something to do, to try on some of these strange clothes. But they got the concepts. They were still dressing their friend, using the correct procedure to do the skill. Shaving, one of the things that's kind of hard to do is to really shave somebody in lab. Occasionally we would have a male student that would let at least the females do a little bit of shaving. But what we found worked really well was taking a glove, blowing it up, using the thumb for the nose, the fingers for the hair, and they'd draw a face on it. And then they'd put the shaving cream and they'd use the safety razors with the plastic cap on and go through the procedure. And so that was always kind of a fun little station. So all of these stations can have some learning with them, but also can have just enough little variety and creativity to make it seem like fun for them. The ambulation one, make sure that you have like long space. Sometimes I would, commandeer like part of a hallway or something for the ambulation with a walker and with a cane and those types of skills.